Deborah Peinels, a psychiatrist who has worked with people with serious mental illness and intellectual and developmental disabilities throughout my career. I am a senior medical and forensic advisor at the National Association of State Mental Health Program Directors, a consultant to the National Association of Directors of Developmental Disability Services, and adjunct clinical professor of psychiatry at the University of Michigan Medical School. Psychopharmacology is an important tool to help treat symptoms and help address complex behaviors, in some cases for individuals with IDD. However, it is only one element of support, especially for persons with IDD, and it may not be indicated. It is preferable to try to manage behaviors in many cases without medication, using strategies such as positive behavioral supports or applied behavioral analysis. It is also important to maximize other therapeutic approaches, such as cognitive behavioral therapy or dialectical behavioral therapy with adaptations for people with IDD. But ignoring symptoms of mental illness or severe complex behaviors that would otherwise benefit from medications would not be appropriate. In this module, we will discuss pharmacological interventions generally, which can be used to help improve the well-being of people with IDD. Treating psychiatric disorders that are comorbid with IDD includes the reasonable use of pharmacological interventions. But there can be risks in overprescribing as well as under-recognizing and under-prescribing for co-occurring conditions that could benefit from a psychopharmacological approach. Module 2 will discuss these risks of over and under prescribing in more detail. Nevertheless, it is important to recognize that prescribers are often walking a fine line that requires careful assessments and development of a biopsychosocial formulation to achieve the best outcomes for our patients. Thorough investigation of environmental precipitants and non-pharmacological strategies to address symptoms that may lead to problematic behavior should precede the use of medication. Evidence of effectiveness of pharmacological interventions is limited, especially without a clear co-occurring mental illness. Clinicians are often faced with making decisions regarding medication management, and they should be making those decisions on a case-by-case basis. Although psychopharmacological practices should be driven by data, this can be challenging. Therefore, for people with IDD, it is important to develop a data mechanism, such as behavior tracking sheets and comprehensive contextual data for the specific individual, given that there is often difficulty in understanding how symptoms and functioning are interrelated and whether the medications being prescribed are actually helping. Problem behaviors in this population are often driven by communication desires, an understanding of which is important prior to using medication to modify behavior. Most commonly used pharmacological interventions in this population often include low-dose antipsychotics, such as risperidone, followed by antidepressants and mood stabilizers. Though most research is completed in adults, use of medications in children with IDD is fairly common. Antipsychotic medications, such as aripiprazole and risperidone, may be effective for reducing challenging behaviors in children with IDD in the short term, but they also carry risks of significant side effects in the long term, including elevated prolactin levels and weight gain. Evidence on long-term effectiveness is not yet thoroughly studied in this population. Many medications used are outside of their approved FDA indication, and off-label prescribing may be as high as 46% among individuals with IDD, according to one study. Most frequently cited off-label indications is for reducing aggression, arousal, behavioral disturbances, and for mood stabilization. The 2021 National Core Indicators data found that 47% of individuals with IDD in the dataset were taking medication to address mood, anxiety, psychosis, behavior changes, or a combination of those issues. Individuals with autism spectrum disorders were more likely to be in the medication group. A 2017 study examining the National Core Indicators data from 2014 to 2015 found that individual-level variables associated with a higher likelihood of taking medications for persons with IDD exhibiting challenging behaviors included being of younger age, being of male gender, having moderate or severe intellectual disability, being ambulatory, communicating verbally, having a behavior plan, requiring support for behavioral challenges, and having a history of mental illness. Having less opportunity to make individual life choices was interestingly associated also with the higher likelihood of being on medications for people with IDD who exhibited these challenging behaviors. The study did not examine why the medications were prescribed, but these associations are worth noting. In this same study, medication use was more likely for those who lived in group home settings. In this module, we discuss psychopharmacology as one element of support, among others, in working with people with IDD and other cognitive challenges. Remember, medications can be an important part of a treatment regimen, but they're not necessarily going to be the only part of the treatment regimen, and we have to take a full biopsychosocial approach to looking at what the individual is presenting. In Module 2, I will discuss the risks of overprescribing and underprescribing in thinking about psychopharmacological approaches to treating symptoms for people with IDD and other cognitive challenges.